I remember one night in bed, 1 o'clock in the morning, and I just had to whip off the covers, and I was just a rush of heat coming right through my body, and I just yelled out, "God, I'm so hot!" And then my husband got up, well, all excited, thinking he was gonna get a little action. And I went, "Look at me, I'm sweating, not gonna happen."
Well, we're here to talk about menopause, and specifically hot flashes, the unique experience that we all have or have had with that special change of life.
So, Dr. Martha, I have a couple of questions. What biologically is happening in my body?
So you remember that the heart pumps out to the body and then the veins carry back and you have a whole circulation cycle. And each one of those has little muscles around it that allow things to contract down or to open up and expand. And so we think that what's happening is you get expansion and extra blood, which makes you feel hot and sweaty and possibly even heart pounding or something rapid. And that's because there are hormone receptors in those little muscles around the veins and the arteries.
I'm on hormone replacement therapy, and I'm wondering, how long do I have to be on it? And the other part of the question is, how long is this menopause going to last? Like, it seems like forever.
So this is the trouble because it's unique. It varies from person to person. Usually people have 2 or 3 years where they're very bothered by symptoms of all of the types that they might have. And the general principle for hormone therapy, if that's the choice that a woman has made, is the lowest dose that will do the job for the shortest period of time that you can. We have non-pharmacy and pharmacy things to do. A whole range of medicines, and some of it depends on how much does it bother you. Some patients say, well, not so bad, and some patients say, I can't sleep, I'm miserable, I'm sleepy during the day, I can't function, I really want to do something different. So the classes of things are lifestyle, diet and exercise. There are actually some foods that have estrogen-like substances. Some people drink soy milk and get better, and they're happy with that. We replace the hormones that you're missing. We think that all of the changes in the blood vessels that lead to that whoosh and sweat and hot and cold are related to that, and your estrogen has reduced. So we talk about what are the pros and cons of doing that. There's some non-hormone medicines that we use that work very well. Things that were developed to treat high blood pressure can treat hot flashes, or things that were developed to treat depression can treat hot flashes. We have actually a lot. So what I would do is sit down with you and go through your circumstances and your risks and how you feel.
Menopause is a totally natural phenomenon that we all have to go through. So why would we even risk our overall health for the treatment of a symptom that will eventually go away?
It's a great question. And it depends on the person. So some people at this phase of life have kind of minor or moderate problems, and they feel like they can cope and function very well. Some people don't. They get sleepless and irritable and really say, in my life, I can't. And that's when you have the discussion about risks and benefits for that person. So that really would be the answer. Not everyone is able to say, natural phase of life, I'm fine, I'll just go through it. Sometimes it's worth a discussion.
I'm kind of done with all the symptoms. So what now? I mean, during it, I would get depressed and go, well, that's menopause, for example. Now, do I go back to the way I was, or what's the new normal?
I like to think about it in terms of phases. We have our youth, and there are good things and bad things about that. Honestly, you can pay me to go back to being 20 again. I've learned a lot. There's sort of a reproductive life where we do or don't make that choice to reproduce, and then we're done with that, and we're ready to move on, and I think we should be elders. We should rejoice in our wisdom. I think if you made the choice for symptoms that were problematic during the difficult phase, hot flashes and can't sleep and possibly depression, and you chose the treatment that you chose, especially if it was hormones, there comes a time when you don't want to take that for the rest of your life. You're not going to continue to have those hot flash troubles, but we taper off. You don't stop a hormone. I think it's better to taper and to go off slowly, to then say, here's my new normal. I still eat healthy and exercise and have passion and meaning in my life and my work, and I'm done with that part. I think that that does come. Wouldn't it be interesting to just be able to talk to people about it and be open and maybe even laugh?
Yeah, that's a good.
I like power surge.
Yes.
Power surge is nice.
We could laugh your flash off. How about that? Right?
I like that.
Because if you could just acknowledge what's going on instead of feeling embarrassed and just say, whew, boy, wow, that was something, right? And then move on. The first one I had hit me when I was in the middle of Target. And I wanted to just rip my clothes off. It was really embarrassing. So I literally ran to the freezer aisle and I opened the door and stuck my head in there. It cooled me off for a little while.